Mr. President, distinguished delegates, civil society representatives, it is a great honor for me to present my fifth thematic report to the Human Rights Council, which focuses on health and care workers as defenders of the right to health. I thank all stakeholders for their contributions received. Since my last interaction with the Council, I undertook 2 country visits to Chile and to Thailand, and I extend my gratitude to both governments for inviting me to assess the realization of the right to health in their countries. I also express my gratitude to all different stakeholders and persons who met with me during the visits. I look forward to representing the report of the visit to Thailand during the 62nd session of the Council, and I'm also grateful to the government of Maldives for accepting my visit by my mandate this year. However, due to the financial situation, that visit will be postponed. Mr. President, my visit to Chile was undertaken from the 21st of November to the 4th of December 2024, and I would like to thank the government again for this invitation, as well as support in preparation and during my official visit. Chile has a strong foundational public health system and has demonstrated considerable political will in its aim to provide universal health coverage to all. Important progress has been made in the enjoyment of the right to health since the end of the dictatorship. For its people to enjoy the highest attainable standard of physical and mental health, particularly those people in vulnerable situations, Chile must continue to address key challenges including mental health, inequalities in access to health facilities, including for those deprived of their liberty, and must promote sexual and reproductive health rights. As everywhere, persons in Chile need access to safe and timely abortion access where they deem appropriate for their right to health. I note that post my visit on 24 May 2025, the government presented a bill to legalize abortion up to 14 weeks, and I urge Chile to decriminalize abortion in all cases, to eliminate the possibility of institutional conscientious objectors, and to remove practical barriers to ensure access to abortions in all areas and regions of the country. Due to Chile's bifurcated private and public health system, there are inequalities in access to health services, goods, and facilities, particularly for those in vulnerable situations, including indigenous peoples. Overall, continued investments through adequate, sustainable budgeting must be made to bolster the public system and shorten waiting periods. Mr. President, your Council entrusted me with the responsibility to witness and report any violations of the right to the highest sustainable standard of physical and mental health. And over the course of my mandate, I bear witness to the reality that in many parts of the world, in the context of protracted wars, genocide, the infrastructure and personnel essential to the realization of the right to health have faced increasing attacks and discrimination, rendering them unable to fulfill their crucial duties. We are sick from multiple and intersecting forms of violence, and collectively the world more than ever needs strong and decisive leadership to end all suffering and to realize the right to health. Mr. President, I present to you today a report focusing on health and care workers as key protectors of the right to health and thus human rights defenders. Determinants of health and their impact on health and care workers. The ability of health and care workers to defend the right to health and other health-related rights is determined by more than personal choices or expertise. It is also shaped by the social determinants of health. Health and care workers may be subjected to hazardous housing, food insecurity, and unrealistic workloads due to a lack of proper healthcare resources in the area of employment. As a primary interface between patients and the health system, they influence and are influenced by several determinants. Market-driven health systems increasingly perceive healthcare as a commodity, enhancing profits over individuals' well-being. Health and care workers may be treated as commodities themselves. Certain health and care workers within the workforce from historically marginalized groups face intersectional barriers that span discriminatory practices, stigma, and structural exclusion from opportunity. These inequalities often manifest as pay gaps, limited access to leadership roles, patient bias, stigma, poor treatment, and legal abuse. During outbreaks and emergencies, as was the case during the Ebola crisis and the COVID-19 pandemic, and also with the health impact of the climate crisis, significantly increase mental health concerns for health and care workers, in particular the lack of pre-established rights-based guidelines to inform decision-making regarding prioritization in crisis on the part of health and care workers, places them on an emotional burden of making decisions themselves without clear parameters. Effective sexual and reproductive health services also depend heavily on health and care workers. Restrictive legal frameworks related to contraception, abortion, third-party authorizations become barriers to accessing sexual and reproductive health care and its services. Health and care workers fear being criminalized, prosecuted, or having other sanctions imposed on them, such as the revocation of their medical licenses. Some frameworks also violate the confidentiality and dignity of patients by forcing the disclosure of such patients' medical records to law enforcement. Guaranteeing confidentiality and privacy is crucial to providing acceptable services to all. Health and care workers continue to serve in systems that expose them to harassment and verbal abuse, sexual violence and physical assault from colleagues, patients, families, and these are among the most prevalent types of violence against care and health workers. In conflict zones, this crisis is much worse. Hospitals, facilities, and transport are sometimes bombed, looted, occupied, raided, and vandalized, and medical staff are sometimes threatened, kidnapped, injured, tortured, or killed. The protection of civilian facilities, including health and care institutions, was once given a well-established international protection. Today, this principle is unprecedented in how it's been challenged to the point where it now appears optional. The foundations for the protection of medical and care facilities are enshrined in international humanitarian law, international human rights law, and the Geneva Convention, and other consensus and resolutions, and have been long normalized. And yet, Mr. President, we find ourselves where perpetrators are not being held accountable. Conflict zones are becoming areas of no human rights, where doctors, paramedics, allied healthcare workers are being prosecuted and targeted for carrying out their work, and medical facilities are being attacked to such an extent that injured victims have no access to care or appropriate treatment, and therefore no chance of survival. This sustained violence caused by attacks on health and care facilities and its workers may amount to genocide in some instances. Finally, Mr. President, my report focuses on good practices and offers a set of recommendations that are solution-orientated. This is important to the goal of creating an equal opportunity to realize the right to a life of dignity and to the right to health. And in this regard, I thank the stakeholders who sent contributions for this particular report. And before concluding, I would like to make a call for the release of all health and care workers around the world who are being detained, harassed, and tortured, and an immediate stop to the targeting and killing of health and care workers. Health and care workers are human rights defenders, and in a world where the full enjoyment of the right to the highest attainable standard of physical and mental health remains a distant goal, health and care workers are key to guaranteeing human rights in their practice, particularly with regard to, but not limited to, the rights to non-discrimination, substantive equality, autonomy, and privacy. There is an urgent need for a paradigm shift to reimagine a health system, and globally, systems that are sustainable and equitable and provide for dignified and compassionate ways in which the humans crucial for its functioning are valued and cared for. And I call on member states to respect and protect the right to health and its underlying determinants of health, specifically the infrastructure and personnel. And I urge all states to strengthen legal frameworks that protect, promote, and respect international legal protections under international human rights law and international humanitarian law for healthcare and workers. And I look forward to continued cooperation with you to ensure that everyone throughout the world can realize the full enjoyment of the right to health in dignity and without discrimination. And I remain available to provide technical assistance on aspects related to my mandate. I thank you, Mr. President.